right, 5 minutes after 11 o'clock. Thank you for tuning in. Some of the audio from the shooter down in Parkland is in the news this morning, and in the audio, which came from a video he made on his phone, I think, he is bragging about what he intends to do. This is before he shot that school and killed 17 people, and he's bragging about it. He's bragging about what he's going to do, and he's bragging about the fact that everybody's going to know his name. And I think we in the media should take it upon ourselves to never mention these guys' names ever again. Don't show their faces. Don't tell their names. And in his aftermath, there were obviously some casualties, and those casualties are not just those who are no longer with us. Those casualties are the students who have to live now with the traumatic stress that they will carry with them, maybe for the rest of their lives. I don't know. It's called post-traumatic stress because it's after the fact. I think we all know that. They put a D on there to identify it as a disorder, implying that it can be fixed. I don't know if it can or not. Dr. Michael S. Scheeringa, however, might know. He's on the phone. He's a professor and vice chair of research for psychiatry at Tulane University School of Medicine. He spent over 23 years researching, treating, and teaching about stress, trauma, post-traumatic stress disorder. He's the founder of Child Counseling Associates, the founder of the Kid Catch Foundation, and his book is titled They'll Never Be the Same, A Parent's Guide to PTSD in Youth. And I would imagine this applies to not only the kids who've gone through something as horrendous as the kids over in Parkland, but also any child, for example, who's been in a car accident, even if there wasn't a casualty in that accident. I imagine, especially as young people, we need a little bit of extra help from those older than them, like ourselves, the age we are. Mm-hmm. Although I don't know. Maybe humans are humans. Dr. Michael Scheeringa, it's an honor to have you on our show. Good morning, sir.
Thank you. Thanks for having me.
Where are you? Where are you calling from?
New Orleans.
I'm the shooting stories come first to mind when I think about what you're talking about in the book. But yet the book was probably started before these stories were even out there.
Right. There's so many different things children can be exposed to for trauma. I mean, we experienced a lot here with Hurricane Katrina and that kind of disaster trauma. And, of course, we have a lot of community violence and child maltreatment, sexual abuse, physical abuse. Right. And then, of course, like you're talking about, we have these things like school shootings. It's kind of like children are in a combat zone almost. Yeah,
I'm going to show my age, and maybe you're old enough to remember this. Do you remember the Who had an album called Tommy? Do you remember that by chance?
Yeah.
Okay.
Yeah.
And Tommy is a kid who witnesses a murder, I think, and goes deaf, dumb, and blind because he's told, you didn't see anything. You didn't hear anything. So the adults who know he witnessed something horrendous kind of give him like a hypnotic suggestion, I guess, to not be able to see, hear, and talk. Is that part of what happens to us when we experience trauma? Do we... I don't know. Do we change that dramatically, or is it possible to change that dramatically?
Well, it's interesting. I didn't remember that backstory of Tommy. I'll have to look that up. But that's cool. Yeah, definitely something changes in people. First of all, good news is 70% of people exposed to trauma are resilient. They're not going to go through these kinds of chronic changes. But that 30% is the part we're talking about. For some reason, they are vulnerable. They do have long-standing changes. For example, one of the stories in the book is about a teenage girl who was sexually assaulted, and she talks in her therapy sessions about how she's never going to be the same, and she can't talk to anybody about it because her classmates haven't gone what she's gone through. She can't sit at the lunch table in the cafeteria and talk to them about being sexually assaulted because they don't have that experience. So it's kind of like living with the new normal, and that's one of the messages is that parents need to know this is chronic. It's not just going to go away on its own, and they need to get professional help.
Do you know, I want to ask you about the sexual trauma specifically, because I think it's got a different category, and if I could be an amateur at what you are a professional at, and therefore asking you in a way by telling you with thought, I think we as a society put such shame and stigma on sex and the healthy approach to sex that when something bad happens to us and somebody treats us wrong or inappropriately, we don't talk about it. And this goes to mostly the girls, although some boys have gone through this as well. So they are being, like, if a child had been slapped or stabbed or something, they might have talked about it more easily than if they were sexually abused because of that shame. Am I right about that? That's just my amateur curiosity wondering about that.
It sounds logical. Like there's that extra stigma because it's more personally embarrassing, and that makes women feel more personally vulnerable. That it is harder to talk about that, and that's one of the big problems is that people don't want to talk about these things, and that limits them getting the help they need.
Sometimes there are fundraising events that will focus on domestic abuse. They'll focus on rape. They'll focus on PTSD in children. But they'll use that in their campaign, but they won't ever come up with any kind of help or an answer, just that they want funds for this.
Well, we need funds for helping people get the right kind of treatment and for research. That's for sure.
So is my assumption that the disorder part implies that there's a fix? There is a way to improve the post-traumatic stress experience?
There is treatment that helps. We have kinds that are called evidence-based treatment now that have been tested in randomized trials. So we have pretty good ideas of how they work and who they work for. About 75% of people who receive one of those kinds of psychotherapies do get substantially better. They don't get cured, and that's one of the things for people to realize is they're going to have some kind of enduring negative feelings and negative thoughts probably their whole lives. You know, we have World War II vets who still have nightmares 40, 50 years later.
Yeah.
It just seems to be the nature of the beast with PTSD.
I think what I was trying to say is that PTSD is becoming such a word that people talk about and throw around all the time that sometimes there are certain things that happen emotionally to people that really can't be categorized under PTSD, and they need their own form of help.
Yes. That's one of I devote a whole chapter to that topic in the book, the difference between stress and trauma. So trauma we're talking about is the type that leads to PTSD, like life-threatening events. They're usually sudden. They have this moment of extreme panic and fear for your life. That's what leads to PTSD. But because PTSD has become so kind of well accepted and popular, whenever somebody wants to bring attention to their particular cause for political reasons or maybe fundraising reasons, they latch it onto the PTSD bandwagon. And that can be counterproductive because it confuses people about what causes PTSD and what doesn't.
So as a psychiatrist, do you deal with a lot of youth who have gone through something that fits that description?
I have. In my research, we've seen 500-600 children of all ages who've gone through a wide variety of different traumatic experiences, and on all those different types are talked about in the book. Yeah.
I'm curious if, and I hope this isn't the wrong word, but I'm curious if evil trauma has the same effect as accidental trauma. If you're in the backseat of a car and it wrecks and somebody in the car dies, but then nobody was at fault, let's say, as opposed to being in a house and somebody comes in and shoots people. Two horrible examples right there. But I mean, one has an evil person doing something, and the other one, nobody was really intentionally trying to hurt anybody. Does that person, those two people in the examples, have a different experience with PTSD?
That is possible. We know that certain types can be more likely to cause PTSD, things like rape, but there's also some things like burns, because you have to deal with the dressing changes and look at the burn scars all the time and the pain that comes with the rehabilitation, and that's not an evil type of trauma. And it's tempting to kind of wonder if different traumas cause things, but I also think of things like motor vehicle accidents, which are not that kind of interpersonal trauma. We have to ride in cars every day of our life, and we have to be reminded every day.
Well,
so yeah.
Well, I didn't mean to interrupt you, but I was just wondering this: if we're in a car and we have an accident, then the car becomes this, I guess, this touch point of something to have some anxiety about. In the same way as if you were, I guess, violated by a man, then all of a sudden all men you're going to have a reaction to men in general. And this happens with animals, right? Have you ever known a dog, for example, that was hurt by a guy with a big mustache? I'm just going to make a story up. And then every time that dog sees a big mustache, it cowers or barks or does something, right?
True.
And is that part of what you have to work with?
That is one of the actual symptoms of PTSD. People get triggered by psychological reminders of their traumatic events. If it was combat and a loud noise of gunfire is your trigger, then if you hear a car backfire, that would trigger you, or a dish falls and crashes. That's exactly one of the PTSD symptoms we deal with.
How do you help people who are in denial get help? Because time is really of the essence.
That is a tough one. One of the things that sometimes help is to appeal to how they are affecting the loved ones in their life. They may not care so much about how their own life is being impaired, but if you can show them that it's affecting their children or affecting their partner, then sometimes that can give them some distance to see that they need to reach out and get help for themselves.
Do you get back on the horse? You know that expression that if the horse tosses you, the best thing you can do is get back on the horse. Does that help? Like, let's say I was hurt in Chicago, and then I never wanted to go back to Chicago. Would it actually benefit me to go back to Chicago? I'm not picking on Chicago, by the way.
Yeah, no. I think it needs to be done in a controlled way, usually with the help of a professional who's taught them some new coping skills before they get back on that horse. That's kind of the bread and butter of psychotherapies, like cognitive behavioral therapies. It's kind of the no pain, no gain. You do need to get back on that horse, but you need some new skills, like relaxation skills, before you do that. And I've seen, for example, a counterproductive example of getting back on the horse of a child who was severely injured in a soccer game, and his father just thought he was weak, so it was forcing him to get back into soccer too quickly. And that kind of is counterproductive.
When the school shootings did happen at the schools, when the students returned to the schools, there was always some kind of on-site counseling offered. Is it better that all of the students attend that, or are there some that say, no, they don't really need it?
There's differences of opinions among experts. There's things called, kind of universal intervention after things like that. And studies have shown that those actually might be more harmful than helpful, because you're kind of forcing something on people who may not be ready and willing to talk about it. And we saw things like that down here in New Orleans after Hurricane Katrina, where a lot of well-meaning people came into schools and did these presentations to children about disaster and trauma. And for some of these kids, that was their first real exposure to the trauma and the disaster. And so it probably needs to be more case-by-case, hand-picked who needs the interventions after things like that.
Tell me about the person who is resisting therapy. I have a real quick story. We do a veteran show here on Thursdays. In fact, it was here this morning. And years ago, there was a couple in here, and he had served in Korea, and she was reading up on PTSD, and she said, "This sounds like my husband," and they had been married a long time. So she said to him, "Why don't you go see if they can help you? I think this is describing you." And he said, "No, oh, come on, I don't need, I'm fine. It's been, you know how many years it's been since I was in Korea, blah, blah, blah." Didn't want to do it. Then one day, I guess, she broke the camel's back, and he said, "All right, I'm going to go." Well, they weren't in here to tell us it didn't work. They were in here to tell us it did work. They said whatever the therapy was that he went through, she said their marriage is so much better now since he went through that. So talk to the people who are resisting going into therapy, and how do you know which therapy to go to? How do you know which one is going to work and which one won't work?
I'll try to give two answers to that. Because one is advice for people is there is therapy that does work. You should reach out, but you also should ask questions of the therapist. Don't just go to any therapist. Not any therapist is trained to handle this. So you can ask them, have you ever seen a patient like me? How many people have you treated with PTSD? What kind of treatment do you use? Do you use evidence-based, things like cognitive behavioral therapy? Explain to me what CBT is. Therapists don't usually like being asked those kinds of questions and being put on the spot, but you need to, as a consumer, to feel comfortable doing that. The second way I'd answer it is, we're kind of talking about what patients need to do, but our industry as psychiatrists, psychologists, and professional workers, we're terrible about advertising to people how we can help them. We don't reach out very well with campaigns or advertising or marketing to let people know what we can do and what is good quality treatment. So I kind of put the blame on us as professionals that we don't do a good job of letting people know how we can help them.
If you do the best job you can for the person and help them, is there a possibility for relapse like 20 years down the road?
Yes, if they're vulnerable once, it's likely they're going to be vulnerable to new traumas that happen to them. But the relapse would probably have to be triggered by some new event in their life. It's unlikely that it would just come out of the blue like that.
Oh, okay.
Have you ever worked with somebody? Now, you work with you. I think the book is focusing on youth, but so this might not apply. But let's say there's a married couple and the husband is just very abusive, and he is very abusive because he's an alcoholic, and then he gets treatment and he overcomes the alcoholism, and he's a perfectly great guy, and now he's wanting forgiveness from his wife for all the crap he gave her. How does it sounds like the PTSD is hers, not his in this case? So would treatment help her to I guess to be open, have open arms with him, to allow him back in her life, or should he just say, forget it, I ruined it, and she should find somebody else?
Well, if she has PTSD from what he did to her, then she could benefit from treatment just to help her deal with her own, memories and negative feelings and triggers, and that may help her deal with her husband's own difficulties. So it definitely could help her in that way. There's also a type of couples counseling for PTSD that people have developed, and if they both are involved in that kind of situation, it might be worthwhile to think of kind of a couple's approach to that.
Yeah. Is there such thing as financial PTSD? These folks out in Hawaii, for example, that are losing everything to this volcano, I'm imagining that they're going through some really traumatic experiences, even if it isn't all financial, because it's all about the houses burning up and everything they've ever owned just disappearing.
Right. So that circles back to the kind of stress versus trauma. Is that is that a stress or is that a life-threatening trauma? We saw the same thing down here in New Orleans with the Deepwater Horizon oil rig spill in the Gulf. All these fishermen and tourist resorts that made their living along the Gulf Coast were losing their financial way of making a living because of the oil spill. It's the same thing you're talking about. They do not develop PTSD. Their life is not in harm's way, but they definitely are stressed, and they may be experiencing depression or other kinds of anxiety that are real and harmful to them, but it's not PTSD.
Okay. How do you encourage the children to open up and get help? Because sometimes they think it's their fault, so they don't want to get anybody else in trouble.
That's a tough one too, because there's a lot of children who will not come to treatment, just like there's a lot of adults, and usually parents can make children come. They have the power to do that with children most of the time, so it's reaching out to the parents to get them to do that. And usually, when people are ready, they're pretty motivated to engage because they're tired of living with these symptoms.
I want to reintroduce you and then give information so people can get the book. The book is called "They'll Never Be the Same: A Parent's Guide to PTSD in Youth." We were a little bit all over the map, but the book is focusing on a parent's guide to PTSD in youth. Maybe your children have seen something like what we were talking about in the opening, with a school shooting or somebody being bullied, or maybe being abused in a home. Dr. Michael S. Scheeringa is the author, and I did find the book on Amazon. Do you have a website dedicated to the book?
Not so much dedicated to the book, but a place where people can find resources. Like they can go to my website and download free checklists that they can fill out themselves about their children, or the children can fill out about themselves if they're old enough, and kind of do their own self-assessment. If you just do like a Google search on Scheeringa Lab, and Scheeringa is spelled Scheeringa, and Scheeringa Lab, you'll find a way to download these free resources.
And by you saying your own name, I just realized I haven't been saying your name correctly, so I apologize for that.
It's all right.
Scheeringa, okay. Dr. Michael Scheeringa, thank you for being on the show with us. Thank you for the work you're doing. This sounds hard. It almost seems easier, and I'm not saying it is easy, but it almost seems easier to do heart surgery than it does psychological work. It's just like I don't even know how you begin to do what you do and to get the results you get. So thank you for doing this.
Thank you for saying that. It's been a pleasure talking with you.
You are welcome. We will take a little break. We'll be right back. This is WOCA Ocala.
Hello, gorgeous.
Hi, this is Becky at Hello Gorgeous Salon. We are located in the heart of downtown Ocala, right next to the historic Marion Theater. I'd like to invite you to stop by and see our new boutique area and meet our staff of professional stylists. Here at Hello Gorgeous, we are ready to update your look with the latest trends. And with summer here, it's the perfect time to brighten up your look. So make your appointment now for those